everyone. This is Sean with the MassSupport Network here with your COVID-19 update for Tuesday, December 1st, 2020. So as a heads up, most of the numbers, data we're looking at here are going to be a little bit off because of the Thanksgiving holiday, and we'll talk about that. But first up, worldwide, we saw about 400 million new cases of COVID-19 during the last week, which is actually a little bit less than it was the week before, maybe about 150, 200,000 fewer cases than the week before. However, that might still, even though that is worldwide, that might still partially be due to the reporting irregularities here in the United States, where we saw about 1.2 million new cases, which is about the same as the week before. And here in Massachusetts, we saw about 18,000, which is also about the same as the week before. But again, take all that with a grain of salt. In terms of deaths, things are more or less the same in terms of the trends, with 70,000 new deaths reported in the last week, 11,000 in the United States, and 217 here in Massachusetts. That's a bit of a spike up for us, about 28 more than the week before. So when we're looking at the numbers in the past week, Thanksgiving is throwing things off a lot. You'll see in 3 out of the 4 metrics here, tests, cases, and deaths, there's all a sharp decline in the last couple of days due to essentially a 4-day weekend. Now weekends always tend to drop the numbers a little bit, but a longer one here is throwing that off especially. So we're going to see a lot of data irregularities in the next couple of days, which I've already started. So first, we're going to see this drop off, where we're just getting fewer things reported due to the delays for offices, labs being closed, fewer people getting tested over holidays, etc. And then in the next couple of days, you'll also probably see a spike, which is going to make things look much bigger than they actually are, which is just the backlog catching up. Now, we probably will also see a spike a little later on, which is a result of the actual transmissions that may have happened over Thanksgiving weekend from people traveling, but that is not what we'll see right away. We'll see probably first a spike that is just a reaction to the backlog. However, the one metric that is not going to be affected by this is hospitalization. So that's the one thing to really look at currently during this next period of wobbly data. See, this is what we saw for cases and tests following Labor Day. You can see there on the left that tests results for cases dropped off for a couple of days after Labor Day and then popped back up and was kind of plateaued for a little while there before the actual fall increase started. Similarly here in deaths, we see even something more like what we're probably going to see here, where we saw a period where the 7-day average was a little bit lower than it had been, suddenly dropping down, and then kind of a bit of a spike, which was kind of that backlog coming in. But when we look at hospitalizations here, we see a pretty clear growth there that's continuing to go on. Obviously, people are still going to be going into hospitals on holidays and weekends, and those numbers are still going to be reported. But you can see here we are at 96,000 people in hospitals. We should probably be crossing 100,000 hospitalizations by the end of the week. You can see that we're actually double where we were at the beginning of last month and triple where we were 2 months ago, as this has really spiked up there. When we look at where the hospitalizations are across the country, they are, of course, everywhere. But the Midwest is the one on top there, with the South having more raw cases, but not quite hitting its highs from the summer surge, so that the West has passed that area. It's also worth noting that the Midwest does appear to be sort of leveling off there, whereas the other areas are still steadily increasing. Now, perhaps the Midwest leveling there might be due to reduced hospitalizations there, but there's a couple of other factors we need to consider that might be the cause, which are not as good as the idea that maybe it's peaking in the Midwest. It could very well be related to hospital capacity in that area, which is some of those rural area in the country there. Also, it's worth noting that in general, we've actually seen hospitalization rates decline as a percentage of the number of new cases. Normally, it's About a week after cases come in, we see about 3.5% of those new case numbers turn into hospitalizations about a week later. About 1 in 29, I think, is the figure there. 1 in 29 new cases today will be hospitalizations in a week. But that number has changed. Now there's fewer hospitalizations as ratio of cases. And the one of the thoughts is presented by Dr. Ashish Jha from the Brown School of Public Health, who put a good discussion of this on Twitter, if you want to look that up, is that what's happening is that hospitalizations are becoming more selective. They just don't have the beds anymore to admit cases that are maybe on the line. So a lot more people who back in October would have been admitted are being sent home. And it's not saying they're not sick, it's just they don't have the resources to treat kind of the borderline cases. Right now, they've got to focus on the most severe ones. So a lot of people are being turned away, likely. And we might see that increase as hospital capacity diminishes. Speaking of Rhode Island, the hospitals in Rhode Island are at capacity currently when they're moving to field hospitals to house additional people. But it's just places are going to start seeing those hospital beds diminish, and then at that point, people who otherwise would qualify for inpatient care aren't going to be getting it. Speaking of that, those hospitals filling up, this shows the week when the hospitalizations were highest in any given state. And as you can see, far and away, it is this last week. So this is most of the country right here has hit their peak hospitalizations in the month of November. There's a few places, us in the Northeast during the first surge, and places in the South and West in the summer surge, but most states are now at their highest capacity for hospitalizations. Also, just looking back at things month by month, that November was one of the worst months of the pandemic. The only metric that it was not the highest on was deaths, fortunately, but it was the most tests conducted, the most cases, the most hospitalizations, and the third most deaths. So we are very much, on track to have an even worse December as we see these trends going up there, and the way that hospitalizations and deaths will follow after cases. But you can see there that even with the data irregularities we're going to be seeing there, we are still on track for a very large spike in the near future. One quick look at long-term care facilities, because the COVID tracking project did a little look at what's going on there. This is just the metrics looking week by week at long-term care facilities across the country. We know these have been a big source of outbreaks. The chart on the far left is the new cases in long-term care facilities week by week. As you can see, the week of November 19th was the worst week for long-term care facilities, even above the previous surges. Now, we have not seen deaths spike correspondingly, but it is the worst since the midsummer spike there. And the number of facilities that are seeing outbreaks is also spiking up again. We had a decent pause there in the late summer and early fall when the number of places that were showing outbreaks was down, but now that's going up. There are more facilities across the country are getting COVID outbreaks. And looking at where that's happening, a lot of that is the Midwest, but it's really spiking across the country there. You can see, like, for example, us here on the right, where the cases in long-term care facilities dropped significantly, but now we're working our way back up. We're the highest we've been since the end of May or April, whereas the Midwest is, of course, just hitting staggering amounts of cases, and these are all new cases per week in long-term care facilities. So, even one case in a place like a nursing home or rehabilitation center, these are places that one case can easily set off an outbreak. So with that, let's move on to developments, because there's a lot of things going on this week. First up, the CDC is looking at changing the length of time of isolation for COVID infection. There's new data showing that really the strongest period of infectiousness is 2 days before symptoms develop and then 5 days after. So there's really a 7-day period there rather than the 10-day time we're saying. And given that people generally aren't getting tested before they're symptomatic, the actual time people need to be in isolation could be much shorter. Now, it's thought this might actually have even greater benefits because people are more likely to be able to isolate for shorter periods of time and thus be more likely to comply with it. And it's been shown that there's very few people are actually really able to financially support their self-isolation for a long period of time. So an isolation term that's just more, that's easier on people is going to make people more likely to comply with it, which will increase the number of isolation that we may. There may be a little bit of virus on either end from people who aren't isolating long enough, but that's going to be hopefully mitigated by just the number of people who are more able to follow it. Also, the CDC is looking to make its vaccine distribution recommendations later today about who should get the vaccine first as we begin rolling these out. There probably not going to be too many surprises in this. It's probably going to start with healthcare workers and people in long-term care facilities. Those are going to be people who are the most exposed and who are needed most to keep fighting the virus. So, but we'll see if there's anything else in there later this week. Also, New York City is reopening its elementary schools after closing all of its schools, in-person schools recently. New York City is, of course, sort of the biggest school district that has tried to keep going with in-person schooling. And there's kind of a growing consensus that elementary school is the thing we need to focus on in terms of keeping schools open, both in terms of the fact that it is less likely for spread in elementary school, and also it's an age group that benefits more or suffers more from distance learning. So we'll see how this goes in the next couple of weeks before the winter break. Also, back to vaccines, Moderna applied for its emergency use authorization from the FDA yesterday. So now we have 2 EUAs pending right now for vaccines. So it looks like vaccines could start going into people by the winter solstice if there's no hiccups on the route to authorization there. Exciting to have those 2 projects going there. Because we are looking at something around the range of maybe 25 to 35 million vaccinations available at the end of the year between Moderna and Pfizer, and then just becomes the logistical issue of actually getting those into people. In less cheerful vaccine news, there are a lot of questions around the AstraZeneca vaccine. This one came out recently with data saying that it was between 70 and 90% effective, depending on if you got the full dose at the first at the full amount or not. But it turned out that the reduced dose, first dose, which turned out to be more effective, was actually a mistake. That someone in one subset of the trial had mismeasured the dose, and a couple thousand people got a reduced dose, which turned out to be more effective. And so there's been a lot of questions about the trial. There seems to be some irregularities and just some issues with the way things were reported. That's kind of casting some doubt on this vaccine project. So AstraZeneca is probably going to have to do a lot more retrials to demonstrate what's going on. There's a lot of calls for transparency about how their trial is being run, and that may slow down the progress on getting that one out. And looking over where we are with vaccines right now, we still have 13 vaccines are still in the phase 3 large-scale efficacy test. We're still getting more vaccine projects entering phase 1 and phase 2. A couple more adding to phase 1 this week. Is there going to be a point where we're just going to have a whole bunch of candidates. Many of these may never actually reach the market, but the technologies that we're putting in place and just the process for doing this is probably going to lead to a lot of scientific developments down the road. And just the ability to do this in this short time frame is still really important. This has kind of been described as being sort of the Apollo project of our time. And in a couple of weeks, we may actually see these last two columns here tick up again as the Pfizer and Moderna vaccines reach approval and start to be distributed. And you can find our stats and sources in the usual places. The COVID tracking does all those wonderful graphs. Mass.gov has the Massachusetts Information Reporting, and New York Times has a pretty easy to use and free tracker for the world and the country at large. For more from the MassSupport Network, you can find us on our website or on social media at massupport.org and Twitter and Facebook. Remember, wear your mask, wash your hands, and we'll be here if you need us. Stay safe.